Please welcome Dr. Tara Maudrie, Assistant Professor at University of Michigan, in conversation with Dr. Donald Warne, Co-Director of the Johns Hopkins Center for Indigenous Health.
Haumitakiapi, Pilame Yayalo. Hello, and thank you to all my relatives here today. On behalf of the Center for Indigenous Health, we're just so pleased to be at the table and part of these important discussions. And we also appreciate the land acknowledgement to start this meeting. That was wonderful. I show this map to emphasize the fact that colonization has had a huge impact on Indigenous peoples worldwide. This is just looking at the lower 48 states. But keep in mind that with the loss of land and territory, it wasn't just sacred sites and locations, it was also food systems. So entire food systems were disrupted as a result of colonization. And when we think about the access to food since that time, we became dependent on federal government food programs, including programs that were rations for food and commodity food programs. So now a lot of people think of fry bread as traditional food. And fry bread is not a traditional indigenous food. It's people doing the best they can with their federal commodity foods. So we never fried dough. That is not a traditional indigenous food. But just very briefly, I'll show you a picture of some of the old commodity foods, things that I even grew up with. And I just call your attention to the picture on the right. That's a large container of corn syrup. And note it's in very fine print, but it says use in baby formula. So this was part of our history in terms of the food that we've had to endure. But we have good news as well. We have a lot of good programs. I'd love to hear from Dr. Maudrie.
Yeah, thank you so much, Don. I want to ground this a little bit in some examples from my own community. So I come from a commercial fishing family, and I'm a descendant of boarding school survivors. And as a reminder, today is Orange Shirt Day, which is a day of remembrance for the many people that never came home from those boarding schools and the continued trauma that our communities continue to face. So to talk a little bit about my community, I mentioned I come from a commercial fishing family, and as we've seen over the last few years, we've had a lot of environmental injustices within our Great Lakes, and that has caused continuing decline to our whitefish populations. But the Sioux tribe has done something really innovative, and they have the only inland walleye and whitefish ponds, and they're continuing to stock those waters with whitefish and walleye, really trying to give back more than we're taking with those fish. And that's a really beautiful example of how we're trying to preserve our sovereignty and our very ways of life in face of some of these environmental justices. And of course, the loss of knowledge from some of our boarding schools, that intergenerational knowledge that wasn't passed on. If you're interested in learning more, this documentary that the Sioux tribe made is available on YouTube. So although Indigenous food systems are so incredibly diverse and there's so much beauty in that diversity, we do have some shared commonalities. And one of those is really that we think of nutrition in a very expansive way when we compared to how Western science sort of defines nutrition in very physical terms around sort of nutrients, servings, and calories. Our communities think about it more as physical, spiritual, emotional, and relational. And those components of our food system really cannot be separated from one another. And of course, that relates to how we think about addressing nutrition in our communities. This Indigenous nourishment model I've used to develop strengths-based Indigenous nutrition measures called the Indigenous Nourishment Scales. And I'm currently working with the Fond du Lac Band of Ojibwe to develop a nutrition curriculum based on addressing food trauma, really thinking through how do we address it through physical ways, spiritual, emotional, and relational. And speaking of which, it's been culturally adapted, this model, by people all over Indian country, and I'm truly honored by that. But speaking of cultural adaptation, I'd love to hear from Dr. Warne about how the culturally adapted Together Overcoming Diabetes intervention is going.
Yeah, we have a wonderful program called Together Overcoming Diabetes. And it does include, of course, nutrition and recommendations for traditional foods, but even in a much broader context. And it's a holistic curriculum that's intergenerational. So it's an adult with type 2 diabetes and a youth family member. So it's focused on diabetes management in the adult and prevention in the youth. And we just finished our phase 1 in South Dakota, and it was a shortened timeline with a relatively small number. There were just 40 dyads who participated, so half got the intervention, half did not. But we already saw statistically significant reductions in depression, anxiety, and blood pressure, and approaching significance for reductions in blood sugar. So we're waiting for phase 2. Of course, that's going to depend on whether or not the government is still open tomorrow. So happy New Fiscal Year's Eve, everybody. But we have a lot of examples in Indigenous populations that are very successful in terms of improving outcomes and utilizing traditional culture as part of the intervention. The challenge is, from a policy perspective, how do we scale that up? We need more resources and acknowledgement of these interventions as being valid and useful. And I would really think that from a policy perspective, that's where we need to see investment in traditional ways. I'll hand it back over to you.
Yeah, so thinking forward to really what's possible and moving beyond this food trauma, there's a lot of really exciting things going on in Indigenous communities, but also sort of an opportunity for everyone. I think Indigenous food system restoration work, there's sort of this misconception that it's just about Indigenous peoples or it's just for us. But we all live here together on Indigenous lands. And that's one of the biggest challenges is how do we live well here together and how do we use these food systems together and how do we learn from one another? And so as we think about Indigenous food systems, when we're restoring these relationships, it's not just about us, it's not just about our communities. It's about climate resilient ecosystems. It's about neighbors that are helping one another. And it's really about thinking about how can our foodways be rooted more in reciprocity and in responsibility to one another and the people and the lands around us. So as we think forward to the future, I really hope that we can continue to have some hope as we work together and remember that this work isn't just for us, it's for everyone, and we invite you to be part of that work with us.
Pilamaya, thank you all very much.